Welcome, everybody. Thank you for tuning in to tonight's podcast. This podcast is funded by AHEC, which is the Area Health Education Centers program. AHEC is a federally funded program established to improve the supply, distribution, retention, and quality of primary care in other health practitioners in medically underserved areas. AHEC provides support services for information dissemination on healthcare issues and participates in collaborative community-based research. So tonight, this is going to be our first podcast in this series. Each episode will be interviewing passionate public health professionals, whether you're a student, an early career professional, or a veteran in the fields. Every interview you will have learned something new about public health and the warriors who fight the good fight every day. So, tonight in our first podcast, we have Dr. Tonya Roberson, Ph.D. and Ph.D.Tr., and Mr. Osagala Ituah, MHA. So right now we're going to start with Dr. Roberson. And then Dr. Roberson, thank you for joining us on our podcast tonight.
Okay, thank you
It's
for
a pleasure.
having me. Okay.
Yeah, so the first questions I want to ask is tell me about yourself. What do you do and how did you get into your career?
Okay. Well, I've always considered myself a true public servant. I've always been the type of person that always wanted to help people and go above and beyond. My mother used to say when I was a little girl that she thought I was going to be a missionary when I grew up because I always wanted to try to help people. And most of the work that I've done has always been in public health. And I didn't even realize it at the time because prior to the field of community psychology, which I'm doing now, I worked in food service systems and clinical food service management. And there I worked in many large academic centers, working with patients at that time, actually teaching diabetics how to count their carbs, how to go to the grocery store and shop and use a food label for a guide for healthier shopping. And from that experience, my 1997, my mother was diagnosed with breast cancer. And my mother was retired as a 35-year educator on the south side of Chicago. At that time, I was working as a health professional. And when she was diagnosed with breast cancer, I noticed that our family, we experienced a lot of implicit bias, racism, and discrimination at the hospital that she was at. And it didn't matter that she was an educator or that I was a health professional. They just saw a black family. And there was a lot of poor miscommunication between the doctor and my mother, even up until the day that she was about to have her mastectomy. They had scheduled her wrong breast to be removed. And
Mhm.
that really alarmed our entire family. My mother was so afraid, and she was educated woman, and she knew. But when she was 8 years old, her father left home in Mississippi to go get a minor surgery to have his appendix removed. I mean, I'm sorry, hemorrhoids removed, and he never returned. The nurse called her mother and told her mother that he died from a heart attack on the operating table. So I'm sure all of this was going through her head when she didn't want us to speak up for her. And at
Mhm.
that time, but my brother and I, we still did. And from that, I just really thought about that experience. I really thought about those individuals that didn't have the health literacy or education to be advocates for their own self. They didn't have family members or anyone there to be with them. Like my grandfather, he died, he was alone. I'm sure he was afraid. It was probably questions he wanted to ask, but it was no one there for him. And so I said, I wanted to be the voice for those people. And I don't want to call them voiceless anymore because I used to say that, but then I saw a commercial one time that said that nobody is voiceless. Everyone has a voice, but certain voices are chosen not to be heard. So I wanted to be there and empower and educate and inspire people in the community, especially to be advocates for their own health.
Wow, that's a passionate story, and that's a very deep story. I can
Mhm.
imagine that is definitely something that is very impactful and really just you know is in your back of your mind when you do everything that you do.
Yeah.
So, where do you currently work right now?
And I'm at Governor State University in University Park in the College of Health and Human Services. And there I am the Director of Community Engagement, Program Development, and Academic Support. And I also am an adjunct. And I am the CEO of a nonprofit, my nonprofit, Helping Communities Help Themselves. It's a family affair.
Oh wow, that's a lot.
Mhm.
You really stay busy.
Yeah.
All right. So in in your position, do you have any interesting research projects? Like I remember hearing that you do something about a diabetes study. Is there something or a diabetes program? Can you speak a little bit more about that?
Well, actually, the diabetes project was the first project when I transitioned from food service systems management and clinical nutrition into research. And I really believe that's how I was able to get that position because food is actually the foundation of a lot of chronic diseases. So it was called Improving Diabetes Care and Outcomes on the South Side of Chicago because just on the South Side of Chicago, there's over 35,000 African Americans with diabetes. And these were statistics from like 2008 and 2014 because that's when it ended that have diabetes and 3 out of 5 don't even know that they have the condition because they're not aware of the signs and symptoms. They don't know their family history, and
Hmm.
then a lot of people they'll get some of the signs or symptoms and then self-diagnose themselves for something else. And so that was my first research project. And then since then, I've had the opportunity to work with breast cancer, prostate cancer, um, dementia, which was very helpful with for me because right now I'm a caregiver of a loved one with dementia, and and mental health. And I'm also currently working on a large project with the Far South Chicago Coalition. One of the organizations in Chicago had a grant proposal that they put out in 2018, and 26 communities in Chicago applied for this quality of life grant, and only two got the grant, and it was for South Shore and for the Far South. And the Far South, it includes Pullman, West Pullman, Roseland, Washington Heights, Argyle Gardens, and then we have 9 key focus areas there. And of course, I'm the chair of the Health and Mental Wellness Committee there. And so right now we're working a lot since we're in the middle of this pandemic, and this is not the first pandemic and won't be the last. I'm really trying to encourage education. Education is the key because a lot of times we rely on the researchers or the doctors or 911 or the ambulance driver. But if we don't know how to articulate or communicate exactly what's going on with us and know the difference between trauma or emergency or if something is very important, then they're not going to know what to do with us when we call them or get to the hospital or to the doctor's office.
I agree. That information is really important. I'm also like interested in, being involved in that kind of knowledge translation with
Hmm.
our communities because it's really important for us to be able to speak up for ourselves and not relying on doctors to do the advocating for us,
Right.
because sometimes we do know, I think we do know what's best for us in our communities.
Yes.
So I think that's really good, especially when you mentioned talking about you know diabetes and heart and the other chronic diseases. That is another thing that really affects our community because we are the highest in a lot of those a lot of those diseases, like the highest incidence or the highest number of patients, the biggest burden is in our community. So knowing how to make how to avoid those and how to make sure that we are managing them also is really important.
Hmm.
So my next question is, do you are you collaborating with any organizations right now in your work?
Yes, I am definitely partnering, collaborating with Project Brotherhood. I'm collaborating with the Far South Chicago Coalition as well as Peer Plus Advocacy. It started off as a cancer group, but then we found that when people have cancer, they have a lot of other different comorbidities or social issues, and so we address those as well. And those are just to name a few.
That's really nice. Do you have anything else? Do you have any collaborations with Black college students at all, or do you do anything with students at all?
Oh yes. Well, actually, that's what I have a 26-year-old daughter who says she didn't have a childhood because I had her doing community outreach every weekend, but she learned how important and how needed that was. So when I was actually working on my doctoral degree for community psychology, I really wanted to have a program, do my dissertation on something that was very impactful. So I had really done so much work already and I wanted it to be innovative. So one day she came to me and she said, "Mom, how do you think, because she saw when we were doing the diabetes project, she's a dancer, she developed a diabetes shuffle for exercise for the patients, and then she
Wow.
had the diabetes star of the month. So she had really got a chance to meet and work with a lot of the patients. So she saw how ill they were and overweight at 40 and 50, where they could barely go up the stairs. So we would always have to have classes on the first floor. So she said, Mom, how do you think African Americans, our health would be at 40 and 50 if they knew at my age preventive measures or had health education or how to even recognize it was a problem? So I said, bingo, that's what I'm going to do my dissertation on. And at that time, she was attending Clark Atlanta University.
Mhm.
And so I assessed the health behaviors, perceptions, and knowledge of African American college students at a HBCU. And I did it, I developed my own data collection tools. I took the regular college health assessments that are normally given at predominantly white institutions, and I culturally tailored it. And I did that by adding spirituality, a spirituality component, ethnic identity, family history, because we don't talk as our culture to keep everything a secret, but family secrets kill family. HBCU culture, and oral health. I added because on a regular college health assessment, they don't even ask you, do you brush your teeth? And there's a lot of disparities in our oral health as well. I did a mixed methods. So I had over 432 students to fill out my paper survey of 88 questions. And then I had 4 focus groups. And then I even did testimonies. And what came out to be most significant as predictors for African American college students at HBCU to want to live healthy lifestyles was spirituality and ethnic identity. Now you wouldn't have gotten that from the regular college health assessment. And then I was glad I did a mixed method because through the testimonies and the focus groups that actually supported the answers that they asked and answered in the paper survey, and they talked about how they can really tell that someone took their time to sit down and write a survey for them. That's why it's so important to consider your target, not think that one size fits all, and know that you're not doing this research on or for them, you're doing it with them. So by me asking those different questions, that's how I was able to develop it. And they knew that somebody could just tell, not just asking them, are you having sex, are you drinking? The fact that I talked about mental health, which is such a stigma in our community and we don't really want to talk about it, but it's okay to not be okay, but you should just still seek professionals and talk to somebody just like you
Mhm.
would if you had a toothache, you would go to the dentist. And because mental health is health. And so that was that the dementia program that I was telling you about that I was working with the University of Illinois. I found that out there because it was African American caregivers of loved ones with dementia. A lot of people wouldn't even sign up for that program because when they heard the word dementia, they thought that meant you were crazy, but it isn't. It's a brain disease. So just having people to get that information informed, give them information and educate them so that they can make informed decisions.
Wow, that's a lot, and that really does make a lot of sense. I think what's kind of stuck with me is that um, as a research, sometimes the research we do we do tailor our research that will in a way that we think is best for the community, or
Hmm.
sometimes researchers do. And I really like the fact that your approach was that you were working with the community that um, you were trying to study or
Right.
trying to do your research on. I think that's
Hmm.
really important. It does sound like it was very meaningful to the participants, the students, but also it gives a little bit more richness, a little more authenticity
Right.
to your research. Um, so it sounds like the obviously even in the research in your dissertation there was a lot of community engagement, and I
Right.
think
It
that's
was.
really important. Can
Hmm.
you talk about, like, I know you did mention previously about a little bit about community engagement, but for in the terms of research, can you talk about community engagement, why it's important?
Hmm. Community engagement is so important to me. It's vital to me. It's just as important, if not more important, than the medical terms and the big words and all the high dollar grants that you propose, because if you don't have the community buy-in, you're still not going to have anything. And I think community engagement it's a certain way that it needs to be done. Like how they say when you walk into the room, you're supposed to speak. But with
Mhm.
community engagement, even though, because I've even had community members tell me, well, you've been in this field and you know all the trends and what's going on because they're just ready for some help. I said, but I feel like if I don't do even a short needs assessment to find out, because one size does not fit all. And then I've learned, even like the blacks on the south side of Chicago, the way I developed a grocery store tour here was different. It had different needs for African Americans in the far south, suburbs. So just to find out and make sure this is something that they actually want. Because the my first experience when I first started with research, I went to the National Institutes of Health. This one group, they report that they got this large grant, and it was for gun violence, and they were having a town hall meeting because they did not include the target or the community at the inception. And that's a
Mhm.
must. You must include them. Don't try to fit a square in a circle. They should be at the table in the beginning, because if you're getting a grant for something that they have no interest in, they don't know anything about, you're not going to have anyone to participate. So they go
Mhm.
to this town hall meeting, and the parents were saying, yes, we're glad that you recognize that we're having this gun violence issue here, and we're sad for the parents that have lost their children. But right now, our biggest concerns is that we can't go to sleep at night because the rodents were so bad in their building. They were afraid they were going to bite their children. And
Wow.
so that was a disconnect there. So I've seen that a lot. And in order, and that's what I did before. And I was so happy that I came out of Chicago where I had already done a lot of work. I went to Clark, and although my daughter was there and she was like the gatekeeper, I still had to, they gave me a research, a dissertation mentor. I had to work with their research sponsored sponsored organization. I talked with the faculty, the staff, the student center, the nurse, their whole health center there. Then I
Mhm.
found out from the students, and I asked them if a researcher was to come down here and do, and I got this data because I wanted to start some programming with it. So they say they want this and they need that, then that's what I wanted to use that as the guidelines for, different programming.
Mhm.
So it's very important to include them and have them. And even when you disseminate you should disseminate your information. Don't come in January of 2022 and take all these surveys and they never get a report of what you found. And then when you get ready to publish or you write other grants, include them in there as well. And I was working with a group at Charles Drew University, and the community members there said, "Don't say that we're underserved or that you are empowering us. Delegate your power and share your power through education and money, and don't say you're serving us and that we're underserved, because when you leave or you pull out and you don't have any more money, then who's going to serve us?" So they
Mhm.
need to learn how to do it themselves.
Yeah, that last part also was something that I remember learning even in research when I was doing my research
Mhm.
with some of my other mentors, is that you need to, it's a give and take
Yeah,
where they'll give you the information, the resources, but they also want something from you. And then
yeah,
same thing is, it's just the back and forth type of thing. And it's very important that people need to be, or the community that you're serving or the community you're doing your research in, they need to be involved in every step of the way. It's very
yeah.
important. I think that's sometimes a disconnect that some research also do have. Um,
Mhm.
in these current times, one of my other questions is, um, how is COVID impacted your work or any work that you do, or are you doing anything differently because of COVID?
Mm. Well, I'm a visionary and I'm very innovative. So I know it's always more than one way to skin a cat. So
Mhm.
it has put some barriers, but I still go out and I go into the community. I try to do as much as I can in person, and with whatever I can't do in person, then I'm on social media or phone calls or Zoom or something like that. Still trying to get the word out, because that education is what's really, really needed. Because right now they say that it's a vaccination hesitancy, but it's really not. Because especially like you mentioned this earlier, that blacks often had highest, well, they had the highest rates in diabetes, heart disease,
Hmm.
stroke. It seems like anything comes out, we have the highest in it. And that's why at the beginning of this pandemic, I wrote a op-ed and I called it "We Are Not All in This Together." And for those who act surprised that more blacks are dying or we're suffering more, they've just been turning a blind eye to the real issue, because COVID only magnified everything that was happening before. And right
Hmm.
now, they're really seeing it come into, reality. And so, and it's education, like I said, because right now you hear people saying, well, how can they have a cure? And this really bothers me because I'm grassroots, I'm in the community, I hear the things that they're saying. So it's a
Hmm.
lot of mistrust, a lot of myths out here, and people, not only are they not hesitant, black people, they're being defiant because they don't want to hear about this anymore, because they hear so
Hmm.
much about the Tuskegee, but then they even hear that, have that story wrong, because they think that they gave them syphilis or gave them a vaccination and they didn't give them anything. They wanted to see the progression of syphilis on black men that haven't, they haven't been given any medicine to. So
Hmm.
it's just, so I have shows like, don't let your future, your health for your future be deterred by the past, so just try to
Hmm.
clarify some of that. So I try to take some of the trends and the things that I hear in the community and bring a show and formulate questions where they could be asked, where education could be given.
Okay, yeah, that's definitely right. Yeah, that's definitely really important. I think I remember hearing so many stories, and I've heard some of those things you talked about when it comes to the misconceptions about even things like medical mistrust and also the
Hmm.
Tuskegee study, and it is something that's very pervasive still. Um,
Right.
and so, my last question is, for all the people that are out there that are getting into public health or early career professionals, like myself, what would you tell them about the importance of networking and how to
Um,
do it?
Well, even before networking, I want to start with, if you're a person that's looking into going into public health or community engagement, or like I said, I mentioned I'm in the College of Health and Human Services. These are public serving roles that you have to deal with the community, with a diverse group of people. Um, even though they're different, to realize that they're still a human being. And I
Mhm.
personally feel that it's certain humanistic qualities, because a lot of people want to get into this field only because it's rewarding, it pays a decent salary, but they're the people that don't need to be around anybody. You know what I'm saying? They need to
Mhm.
probably like work in a cubicle by themselves. So it's certain humanistic qualities like being transparent, trustworthy, because while you're one person in a large community, everyone's looking at you. They're watching how you're talking to people. Are you being fair? When they hear that you got a grant, are you actually coming in doing what you're saying you're going to do for this community? Are you helping one person or five people or 100 people? And not saying that numbers doesn't matter, which I've heard working in research a lot of times when I'm out there busting myself trying to really help as many people as possible. But just to have certain humanistic qualities so that you are able to get out and reach the masses and touch and educate and inform and inspire as many people as you can. Like meeting people, like my role as a community psychologist is to meet people where they are in the context of their community to help them cope. And at first, I felt like one point that I was like all over the place, but when I actually thought about it, when you're in the community, I deal with reentry, I deal with COVID, that
Mhm.
lack of resources, vaccines, food deserts. I mean, all kind of stuff, healthcare, access to healthcare, how to talk to your doctor. I developed 10 tips on how to make your doctor's visit a success. So you will come, you can be empowered by the fact that your doctor has their job only because of you. So if they're not answering your questions, don't just sit there and nod your head, yes or not, doctor, to the next visit, and then don't go home and comply to anything that he told you to do. So it's
Mhm.
like, it's a lot of things. It feels like sometimes it's like I'm everywhere, but I'm in the community, and that's where people spend the majority of their time outside of their doctor's visits, going to work or school. So That's really important. And make sure it's something, and everything is not for everyone. Even if you're in public health, you might be a good writer or a good surveyor, then it might be other people, because there's a lot of different facets that you could go into. But whatever one is in, make sure it's something that you really enjoy doing, because when you enjoy doing something, you're going to do the best that you can do in it.
Yeah, that's really good. Thank you for the advice. I know this is probably we're about to get finished up with the interview with you. I really want to thank you for appearing tonight. This information is really insightful and really helpful for our audience and for everyone that's going to be interested in public health. Because I know that I wish I discovered public health when I was in my undergrad. I didn't
Hmm.
learn about it until near my master's, and this is something that I really do have a passion for. I know a lot of people, a lot of students are going to be watching and listening and hoping that they can find some, their path through you
Right.
and through the people that we'll be interviewing up next. But I want to say thank you for coming on tonight, and I really appreciate it.
Okay, and thank you for having me.
Yeah, no problem. So you can stay on. I think we'll be having our next guest coming in rather soon,
Okay.
I'll say, and I'm hoping that he'll be showing up in here.
Okay.
Um, but in the meantime, um, so I guess we'll just wait a little bit, but we'll circle back to just a little bit more about the networking.
Okay.
Are you involved in anything APHA at all, or have you been to any of the conferences?
Yes, I've been going to the conferences every year since 2014, and I really enjoyed them. In the beginning, before I actually joined any caucuses or forums, I would just submit an abstract, have it accepted, go and speak, and fly back home. But since I'm the past chair of the community-based public health caucus, and since I've been in that caucus, I've been there for more days, getting to go to more joint sessions, meeting other individuals or public health professionals from all around the world, and just being involved in a lot of other things. Because in the community based public health caucus, our steering committee is NC Bone, and that stands for National Based Community no community based organizations. And when we go to these cities, community organizations that's really doing the grassroots work, they don't know anything about APHA. They're not able to go to the conferences, they don't read the publications. So we make it our duties to go out in the community and find the people that are really doing good work in the hood. And then we find them, and we have unsung heroes award ceremony for them. And we're doing that every year. And so this year, the group I mentioned that I'm working with the Far South Chicago Coalition, along with Project Brotherhood, we plan on going to Boston earlier so that we can hit the ground running and actually go. And I really want to get the people that are really doing the good work so we can have like a really nice reception this year. Last year in Denver, we had the reception. It was virtual. We had about 12 organizations, but they were really meaningful organizations, and it was still really nice, and they enjoyed it. And I just want to keep in touch with them because, like I said, I'm a community psychologist.
Mhm.
So I said that when I received my degree, that my degree and all of the work that I do is going to be for the community and with them. So if they need me to be on something, um, or need my support or whatever, I'm there to help them.
Wow, that's so passionate. Yeah, so thank you for that last bit of information. Um, I know you have to go. Like I
Okay.
said, thank you so much for coming on and
Okay.
speaking about what you do and your history. It's very much appreciated.
Okay.
Um,
Thank you.
so yeah, take care, and
Okay.
hopefully we'll see you some other time.
Okay. Thank you. Okay. Bye
Bye.
bye.
Hey, OC.
Can you hear me okay?
Yeah, I can hear you now.
Okay. Beautiful, beautiful. How you
Man,
doing, Alex?
pretty
Long time no
good.
see.
Right, I was gonna say the same thing to you. Long time no see.
Yeah, yeah.
We just look. So for the audience that didn't know, we just left with a great conversation with Dr. Tonya Roberson, and now we're going to be having a quick conversation with Mr. Sigale. Um, so OC is one of my, as I've known OC for a little bit of time, and he's one of my colleagues that when we graduated from UIC. So we're gonna be asking him about his perspective on public health. So OC, I have a few questions for you. Just talking about your experiences and what you've been doing so far. Post UIC, how's that been going? And just for the audience to get used to hearing about public health and from a different light from other people. So my first question is, tell me how'd you get in your to what tell me how you got in your career. Like what's your background like and what have you been doing?
Yeah, absolutely. So, thank you for having me, Alex. I really appreciate it. So again, my name is OC. I hail from Compton, California. So I'm a California native. I attended the University of Wisconsin-Madison. I got my degree in biology, and I was trying to figure out between going to medical school. I knew I wanted to pursue healthcare. I knew I had a passion for public health, but I didn't know in what capacity I wanted to practice that in. And so I ended up doing a pivot. I ended up going to graduate school, and I ended up doing my master's program in healthcare administration. And so that's kind of what I do now. After graduate school, I went and completed an administrative fellowship at Advocate Aurora Health. So I work at two hospitals on the south side of Chicago, one in the south suburbs and the other on the southeast side of Chicago, Advocate Trinity and Advocate South Suburban. And so essentially in my fellowship program, I reported directly to the senior leadership team. I did a lot of the administrative tasks from operations perspective, but I also did a lot of work in the OR. So a lot of my work is really it consists of improving efficiency. So
Mhm.
identifying delays and identifying barriers and processes, whether they be clinical, whether they be non-clinical. There's a lot of things that go into a patient's care when they're at their stay in the hospital.
Mhm.
And my job really is to work with leaders, facilitate meetings, identify the problem areas. I kind of make committees, and we kind of identify what areas we're using data to improve efficiency for patients' care at our sites, right? And
Mhm.
so that's really what my world is. And so now I'm the hospital services manager as of last month. So I'm responsible for all of the operations and improving those projects at both of my hospital sites currently.
Wow, that's a lot.
Yeah, yeah.
Congrats. First of all, congrats on your new position. But yeah,
Thank you.
that's a lot. That's a lot going on. So, I know we were at USC for a little bit at one point, like I said in the past. But what got you into public health? Like, why are you passionate about this field?
Yeah, no, thank you for that. And that's a really good question. I think a lot of my passion stems from where I grew up at. I think and growing up in the community I grew up in, I saw a lot of gun violence, a lot of some of the things that you would find in the South Side of Chicago, right? And I always asked a lot of questions that I never really got the answers to, right? And so I
Mhm.
always snuck out and saw out health and healthcare as a way to solve those problems. And I thought it was going to be from a medical clinical perspective, but again, a lot of the issues that I grew up with were all related to public health issues, whether they be the disparities that exist in primary care access, whether the disparities that exist within behavioral health and accessing healthcare needs for communities that are underserved. All the things that I saw and questioned in some way, shape, or form correlated to those topics. And I felt like, working in this field, we have access to a vast amount of resources that can be used to make impact. But I think there's still a very large disconnect in our ability to really touch the communities that need it most. And I think that's an ongoing conversation that I've kind of been trying to figure out how we can do better in that work and in that space. But I do appreciate learning about how healthcare impacts individuals from a hospital care setting. It's very fascinating. Every day is different, but I do feel like I get a very sense of good value and making an impact with the work that I do.
Yeah, that definitely sounds like me too. I had a similar kind of desire. I was once going to med school, and then I thought about a bigger way to help the community outside of med school. But yeah, so that's really like we have a similar background with that. So are you? So since grad school and moving on into your professional career, have you been involved in any research at all?
No, I have not, and I think that kind of goes with the organization that I'm involved with. We're not really like a research based, like not like a UIC where we do research in clinical spaces.
Hmm.
We don't have any research studies that actually go on within our sites. We're teaching hospitals. We have teaching hospitals, but we don't have that academic aspect to us, like a University of Chicago or a uh, or a UIC or a UI Health, and so. I think there is opportunity to kind of maybe see about that. I don't think there's anything that could stop us from doing that, but we don't
Hmm.
have those components within our organization. So I haven't really been in a lot of research since graduate school.
No, it's no problem. I just had to
Yeah,
had to ask that question. So
yeah.
this is a AHEC podcast with a Project Brotherhood. I know you know Mr. Marcus Murray, obviously.
Hmm.
How did you meet him, and what was that first encounter like?
Yeah. Oh, that's a great question. So I met Marcus in the summer of 2018. I had just moved to Chicago from Compton. I'm new to the city, didn't have a car. I was doing a pre-matriculation program, which is like they call it PMP at the UIC. And so they really have every day you have coursework and they usually bring out a speaker. And that day, this happened to be Marcus. And I walked in really late. I'm pretty much the only African American guy in the room besides him, and he kind of just calls me out. Hey, my man, where you from? And I told him where I was from, and we kind of talked, and then thereafter, I got his contact information. I hit him up immediately because of I was just so impressed by like his political health background, his knowledge, his acumen, but his ability to relate to others. Right, I felt an immediate connection to him instantly, and that led to me getting my first position with the Community Global Health Association with Dr. Adam Murphy's project. I worked with him along with Andre for a full about a year and a half, I would say, and really Marcus helped me get my first job. Coming to Chicago, he helped me get to the park where they were doing research at. He gave
Mhm.
me a printer, he gave me a laptop, like just show me genuine love as a young black man trying to figure out grad school and like learn new to the city. He really gave me a lot of good information and got my resume in the right hands that helped me get to open the doors that's led me to where I'm at today.
Wow, Project Brotherhood is and Mr. Murray have done a lot. Like
Yeah.
that's
Yep.
amazing. Yeah, Marcus has always been really supportive of you know young people and hoping that we can be the future for the next generation or future of public health moving forward. So it sounds like it was very positive
Yeah.
in that regard.
Absolutely, absolutely. I wouldn't, but I speak very highly of Marcus and the work they do at Project Brotherhood, candidly, and just the way they support young students, right? And we're often unsure about a lot of things, and because we're young and we want to figure things out, but they really give you a lot of guidance and mentorship, which is important in anybody who's an aspiring careerist in any field. So
Yeah,
kudos to him.
yeah. The connections that I've gotten from them are just amazing.
Yeah,
So partially, I wouldn't be here where I am today without Marcus and his connections from Project Brotherhood. So, as a public health professional, I'm assuming you've been to APHA.
yeah, several twice. I went to the one in San Diego and the one in Philadelphia.
So, yeah. So, how was your experience there? It sounds like that what have you done while you were at APHA? Were anything you were involved in at
Yeah.
all while you were there?
Yeah, so I actually moderated a session. It was a host of speakers that came for a public health session, and Marcus pretty much say, "Hey, I need somebody to come moderate and speak at this event. Can you do it?" They want me to do it, but I figured I don't want to do it, so why don't you do it? So I was like, okay, cool. And so I did it, and it was actually a really great opportunity. I met a vast amount of health professionals from different sectors, different fields, and they all presented. I introduced them, and they spoke and they gave their presentations to the audience, and then I facilitated the conversation that led to the dialogue and the question and answer portion afterwards as well. Again, that just shows that just knowing Marcus, I was able to attend two different APHA events. facilitate and moderate and speak at both events in some capacity, and then also being able to network with other public health professionals that look like me from all across the nation. It was a great opportunity and great experience, and again, I wouldn't be in those spaces again without Marcus. So,
Wow, that's really good. So my last question for you is, this podcast is mostly about, introducing great public health professionals and, get trying to give people, early health students, early career professionals, and, even some veterans in the public health field, some insight into what some professionals are doing every day. I think one of the biggest things that we talk about, or the biggest things that we should emphasize, is networking. What advice would you give to young people who are just starting out, or young people like us, really just starting out? What would you give about some advice about networking, in the context of how far you've come?
yeah, I think we always have this formalized process of networking, right? Like you have to go to a session, you have to wear a suit and tie, but networking is in almost every aspect of life, right? And I think that is one thing that we need to always be cognizant of. Always be authentic, always be yourself, but you never know who you can meet, where you can meet them at, and you have to always kind of be ready, right? And then I think one of the things I'm trying to work on too is my growth areas for 2022 is maintaining relationships, right? I think I do a really good job of meeting people, networking, and hey, I'm so and so, but you really have to put in the additional work to not only meet but follow up, right? And then check in and really keep in contact with people you've interacted with, or it's hard for you to kind of maintain those networks, over time. So utilizing your resources, LinkedIn, in whatever capacity you've garnished those networks. But I think that's a really important aspect to not only put yourself out there, to always stay ready. You never know who you can meet. I actually met the CFO of Huron, right? It's like a very large healthcare consulting firm on a flight to Toronto, right? And that conversation started simply by me looking at his computer, seeing that Huron was on his laptop and on a header. And Huron actually consulted at my organization at Ituah Health for quite some time. And I just asked him, hey, what do you do at Huron? And so that's just one of the things where you never know who you can meet, where you can meet them. But so make sure you're always on your P's and Q's, and be be genuine, be authentic, be yourself, and ask really good questions. And people love it when you're hungry for knowledge and you really genuinely want to know more about the work they do, their world, and how they make an impact on people's lives. So those are some of my keys and tips and golden nuggets to making sure you network effectively.
Wow, yeah, thank you. With that, those are all my interview questions. I appreciate you coming out to on our podcast and giving us your wisdom and also showing us your passion for public health. It's really much appreciated.
Yeah, absolutely, Alex. It's been a pleasure. Honestly, I'm so happy to see you again. It's been quite some time. I know COVID has been running amok for the last 2 years now. So I'm
Mhm.
hopefully at some point we'll be able to come back together again. And I really miss. I haven't seen Marcus in quite some time, or Dr. Watson, or anybody. So I
Mhm.
think it was long overdue. It's long overdue for a get together.
Yeah, hopefully in future podcasts we'll definitely have all of them together on as guests, and maybe we can have a whole conversation session about some other public health topic. At least we'll be able to meet virtually in that
Yeah,
context.
yeah,
So
absolutely.
with that, I really do hope you have a great night, and good luck in everything you do in your career.
Thank you, Alex. I appreciate it. You as well. So we'll be destined to come into contact again soon. So
Oh
you have
yeah,
a good
for
one.
sure. You too.
All right. All right. Thank you. Bye bye.
Mhm.